Hello, and a big welcome to the COVID conversations here at Oxford University. I'm Nairi Woods, and I'm the founding dean of the Blavatnik School of Government, which you can see behind me if you haven't been in Oxford for a while. I hope you'll come visit us soon. It's a huge pleasure today to introduce my colleague, Dr. Thomas Hale. Tom has been an associate professor at the Blavatnik School almost since its birth, nearly 10 years ago, and has been a scholar of international cooperation on transnational disputes. He wrote a brilliant book, Between Interests and Law, and on climate change, on which he wrote a book, Gridlock, which examines why global cooperation is failing even when we need it the most. And Tom, you know, your work to date has really focused on how to get cooperation across the world from bottom up on climate change. And you did an amazing job helping the world come together in those climate change negotiations in Paris by helping people understand what their local communities were doing. Now we live in a world with the coronavirus, and you made an extraordinarily quick move to think about what global cooperation needed here. So just tell us about what that was and why it is that you began this work on the Oxford Government Response Tracker.
Thank you, Nari. The common thread between climate change and COVID, or really any crisis we face, is that we rely on governments and public policy at all levels to help us address these challenges that are so vast, no individual can solve them alone. You know, we each hope that our body will be strong enough to ward off the coronavirus should we be exposed to it, but we actually rely mostly on the body politic, the policies that we'd adopt as governments, the behavior of ourselves and our neighbors to protect us. These are the things that are happening now that we need to rely on as we wait for vaccines and treatments to be developed. And I think as a political scientist, my worry is that the first months of this pandemic have shown that those political and social immune systems, if you will, are not as strong as we need them to be. And that's true in climate change and certainly true here with COVID-19.
Yeah, I mean, that's been amazing for the rest of the world to watch. Big, endowed countries like the United States and the United Kingdom, countries that actually had scored themselves very highly on pandemic preparedness only 2 years ago, seem to have done so badly. And yet some really poor countries, I mean, in Europe, it's Greece that looks like it's done best. Why is this? What are you finding when you look at the government response tracker?
So that was exactly the question that we were asking in mid-March. If I guess take you back to the end of term here in Oxford, about 4 months ago or so, we were looking at governments doing all different kinds of new sorts of quite draconian responses, things that were unprecedented, at least at the time. We were wondering, why are governments doing this? What impact is it having on the spread of the disease? And can we make some sort of sense of it? And we're thinking about that in my Politics of Policymaking class, which I teach the Masters of Public Policy students in the Blavatnik School. And we actually realized that we didn't have a data source out there to draw on to compare different countries, but we had in the room, in the 120 or so students in the room who come from 50 or so different countries, a huge amount of knowledge that actually can help us compare governments to learn exactly what is going on and why governments are responding differently, what effects it might be having. So we thought, actually we should keep this in our classroom, we should systematize it. And so 3 weeks after that, we launched the Oxford COVID-19 Government Response Tracker, which today has grown into really the primary source for information on what governments are doing against coronavirus in a comparable way across the world. It currently includes 175 countries. It's updated twice per week, and it records 18 different kinds of indicators, things like lockdowns that we all hear about, but also economic policies, health policies, other kinds of responses that are important for fighting this crisis. All of that's possible because of a huge volunteer army of around 150 Oxford students, alumni, staff, friends from all over the world who are putting their effort and work into this every single week. So a huge thank you to all of them for making it possible. It's become a hugely useful resource for us as researchers, but also for decision makers who are trying to figure out in real time what works and what doesn't.
And you know, all the other trackers I've looked at seem to rely entirely on English language sources, and that gives them this huge bias of countries that publish stuff in English. How have you managed to look at 173 different countries, including some that publish nothing in English?
It's a huge challenge. As a social scientist, you know, I we prize in our discipline having comparable information. So there's no sort of machine learning tool or algorithm that can do this for us. It really requires people who have deep contextual knowledge, language skills, of course, of every single country to understand what's going on, what's happening there, and to put that into a comparable system. So the project is trying to create a global snapshot that allows us to compare countries against each other in some kind of standardized way. That has its limits, of course. Context really matters, and you can't capture all the nuances in exactly the same way across countries, but it's an important starting point, because if we don't compare what works in one place and what works in another place, we're not going to have an evidence base for governments to build on going forward.
So you've got about 100 Oxford alumni all around the world working in different languages and then collating all the data in Oxford. Just a last word on how does that work? How do you pull all that input together twice a week so as to give the world this very up-to-date tracker?
So we ask our data collectors to go through a training process, which they do online, that teaches them what indicators we're collecting information on, for example, workplace closings or school closings, how we record that information, usually on a simple ordinal scale. So for example, is a school closing required? Is it applying to all levels of schooling or some? Is it just a recommendation? These are the kinds of indicators of how restrictive the policies are that we're trying to gather. They then scour government websites, local media sources, and try to find a sort of triangulation of evidence that allows them to say, actually, this country's policy is this on a given day. They then put that into our global database. It cycles through a series of checks, so it gets looked at again by a second coder in due course, and then put out in real time for the whole world to see. So one of the advantages of that is we also get a lot of feedback from the public and from others who say, actually, we think this could be changed a bit that way. So we're really building this airplane as we fly it. But that kind of instantaneous decision-making is what governments are doing. So we need to be able to operate at that kind of time scale.
And it's a pretty extraordinary thing that you and your team have done. I mean, I see the tracker being used by the Wall Street Journal, the Financial Times, The Economist, Bloomberg. I see it being used by prime ministers and presidents around the world. What is the information that it's giving people that is so important? What do you think we've already learnt so far about what works and why?
So I think the strongest conclusion that's emerging based on our data, but also many other studies, and really this is the biggest one people have been focused on in the first months, is do these policies actually break the chain of infection? Is it going to help us stop the huge takeoff of disease that we see around the world? I'm going to share a quick graph with you to demonstrate that point. So if you look at the image here, you can see a graph from Bloomberg using our data, which shows countries divided into 4 different categories. Those that responded very quickly, the fast; those that responded slowly, the slow; those that responded with very restrictive measures, the strong; and those that had less restrictive measures, which they call the weak. And as you can see, as time goes on, since the country experiences its first case, you see very different levels of death in terms of per capita terms in these 4 different categories. The fast and strong, the dark purple line at the bottom, see a much lower rate of death than the slow and the weak, which is that large red spike.
And Tom, who are the fast and strong? Give us a couple of countries that fall into that category.
So a few examples here would be Croatia, Greece, those countries that happen to experience the virus a bit later and were able to put measures in place quite quickly. New Zealand is another good example here.
And who are the slow and weak?
So here we see a number of governments that have been, for example, downplaying the seriousness of the virus and quite reluctant to impose policies. Some examples are Nicaragua, Belarus, Russia, or others there. Many, though, fall into other categories. So I put, for example, the UK into sort of a whiplash category, which is a bit another large category where measures were quite slow to come in, but when they did come in, they went to a pretty high level of stringency quite quickly. So there's a wide range of responses here. The key thing, though, is that early action really matters. And that's what governments were struggling with, I think, in the past few months, to be able to decide under very difficult conditions, a lot of uncertainty, what to do. And those that made the choice to act quickly have seen the benefits.
And what now, Tom? I mean, we saw a lot of governments do that and respond quickly and get on top of it. But now, as countries try to ease out of lockdown, we're seeing some countries really get caught in what some call a second spike or a second wave. I'm not sure which it is, but it's it's more infections fast. Does the tracker help us understand how to do this better?
It's beginning to, and this is really the most important research question, I think, going forward, because locking down a modern society is sort of like amputating a limb to treat an infection. It might be necessary if you have to do it, if you have no other option, but it's pretty costly, and it's not something you can repeat again and again without causing some real lasting damage. So the key question we need to figure out is, what is the minimum package of restrictions to have the maximum impact on public health? And that's a complicated question because it's probably going to vary in lots of ways from country to country, right? Countries have different cultures and economies and physical setups of cities and all sorts of different factors that mean that these kinds of interventions have different effects in different parts of the world. And so each country needs to work very hard to design the best possible package for its particular context. That requires a lot of data to be able to compare different countries to each other and understand what works and what doesn't. So that's what we're hoping to advance now in the research work around the tracker.
Mm-hmm. Brian, who's watching this, asks, we hear a lot about it being too soon to judge which country's taken the best route to tackling COVID-19. When do you think we'll be able to properly evaluate who approached this best?
So there's still quite a lot of uncertainty, of course, around how long the virus will be with us. Depends on how quickly vaccines are developed. As we learn more about the disease itself, how quickly it is to mutate or to reappear, we'll have to really think about what that's going to look like. I think we're already at a point to say which responses were most effective in the first months, but that's no guarantee, of course, that they're going to continue to be effective in the next little bit. So I would say we can make an initial evaluation now, and that's what the Bloomberg graph I showed, I think, tries to do. But we have to realize that this is not going to necessarily be a prediction of who's also going to do well in the future. And when all is said and done, my own sense is that governments will have to be able to learn very quickly. And what we'll see is that the governments that are best able to learn and adapt and humble enough to change course when they need to change course, and smart enough to figure out how to tailor these responses to their own context, those will be the ones who succeed in the end.
It's interesting that you use the word, humble, because it looks as though it's countries that were both humble about how well they could deal with the virus, but also humble about their own capability. That a number of the countries that you've mentioned, Croatia, Greece, New Zealand, and I think about Germany, we're quite quick to say, actually, we can't do this as central government all on our own. We're going to need our businesses, our universities, our local governments, our mayors, and we're going to have to forge a real partnership with them. But is that too anecdotal? Is there a pattern on that?
No, I think that's right. I think governments that thought, though, we've got this, quickly learned that they may not have. And actually many developing countries, because they understood that their healthcare systems would be quickly overwhelmed by a huge surge of cases, as had been seen in other countries, responded very proactively because they were aware of the limits of what could be achieved through the healthcare system. One great example of that is actually in most of the Caribbean states were fantastically proactive. These are economies that relied to a much extent on travel, on tourism, but actually they made the choices to lock down way before the cases began to spread much in the region. I think that's been a very positive outcome.
Tom, partway through the tracker, when countries started thinking about whether they should ease the lockdown, the World Health Organization produced guidelines saying, before you start easing up, make sure you've got these 6 things in place. And you started tracking whether countries had those things in place. Have countries eased the lockdown when they've got those things in place, or does your tracker tell us that they're easing up regardless?
Much more the latter. So we do record a number of the criteria that the World Health Organization would like countries to have in place before they begin to roll back these kinds of lockdown policies. Those are things like, have you got cases under control? Have you put in place health systems that can manage any kind of testing and tracing that needs to be done to control that level of cases? Things like that. Have you put in travel controls to make sure that there's a system for making sure you're not importing new cases? All of those things are common sense things to do, but actually countries have been struggling to get all of them lined up before they begin to roll back lockdown. Almost very, very, very few countries have actually met all of the World Health Organization's criteria before beginning to ease measures. That's of course coming for many reasons. These are restrictive policies, they're quite costly, it's hard to keep them in place. But the worry is, if we roll them back too quickly, we could have basically got no gain for all of that pain we had in the first wave of lockdown. If we see a second spike, I think we're seeing this now across many parts of the south and west of the United States, for example, we're going to find ourselves back to square one, and no one wants that.
And just to be clear, are the countries and the regions that have that second spike, are they the ones that have not gone far enough towards the World Health Organization's criteria?
In many cases, yes. So certainly it's the primary criterion that matters most from the World Health Organization is, of course, have you got the number of new cases coming up every day down to a manageable level where you can have a reasonable chance of using testing and tracing to control any outbreaks when they flare up. And countries that haven't done that, who have rolled back their policies before getting cases down to that manageable level, are seeing a lot of the problems. And that really highlights the importance of testing. You know, you can use lockdown to wrench back yourself from an exponential growth scenario, but to maintain those gains, to preserve those hard-won gains, you need to have a robust health system in place that can catch flare-ups before they get spiral out of control again.
And Tom, how useful is it for countries to have this information? Is there a risk that countries just end up copying each other without thinking about what's right for themselves at any particular time in this crisis?
I think that's absolutely a risk. And actually, if I can show you one more picture. So in the first months of the pandemic, we saw a lot of what you might call bandwagoning behavior or copycat behavior. This graph shows you on every row a country, and across the bottom axis, it shows you the time, the first progression through time in the first half of the year. The black dots show you when a country had its first case. The white dots show you when a country had its first death. So that's about the spread of the disease. The blue dots instead show you when countries reach a particularly restrictive set of policies on our scale. And what you can see here is that almost all countries pass this threshold of lockdown in the same 2 weeks in March. That was when the World Health Organization declared a pandemic. It was when we saw a lot of media reports coming out of Italy showing the horrible situation in hospitals there. It was when Google searches for coronavirus started spiking. So a lot of stuff was happening at the same time. And we saw governments really follow each other into the same set of policies. That's actually not what the World Health Organization was recommending, which was instead to phase the policies along the spread of the disease. So it's kind of herd behavior, if you will, meant that some countries got lucky. They were acting preventively before the virus got to them. Some were very unlucky. They were acting too late. And many were sort of following public sentiment as opposed to what you might think of as a more evidence-based approach.
So that herd behavior was good in the beginning of the crisis because it got some countries to act earlier. But are we seeing herd behavior now with the easing of the lockdown? And is that bad? I mean,
So I think we're seeing a lot more variation now, which is probably good because countries should be adapting their lockdowns to the situation they face. I would suggest, however, that there's still a lot of benchmarking vis-a-vis other countries, and we see a lot of regional contagion. So if one country or region starts to do something, others tend to follow suit. I think that underscores how governments think about the problem. They really want to look to international comparators to be able to gauge their responses. When you're making policy under uncertainty, that's probably not a bad starting point. But going forward, we need to really leverage that kind of comparison to make it much more evidence-based, as we're trying to support and empower with the tracker data.
Tom, we're having that. You've mentioned the World Health Organization a few times. It's an organization that's disseminating some of the evidence and guidelines that you've been talking about. This morning, President Trump formally withdrew the United States from the World Health Organization, and a number of the audience today have put in questions about the World Health Organization. How important is it to helping countries respond to this crisis?
I think an organization like the World Health Organization is absolutely critical to responding to this kind of crisis. After events like SARS or MERS or Ebola, the kind of monitoring system the World Health Organization has put into place where countries can report that they have new viruses that might be difficult coming forward, that's incredibly important information that we need international cooperation to sustain. So if we didn't have a World Health Organization, we'd have to invent it again because that's such a critical function that governments need. I'm really concerned that governments haven't been rising to the challenge of cooperation here. This is a transnational problem. It's like climate change. It's like many other kinds of problems. It doesn't have a solution that's purely contained within a border. Because even if a country does a great job of controlling its epidemic locally, we're only as strong as the weakest link in this chain. We're all connected, and that means that we need to have a global solution eventually to this kind of problem. What we need to see governments doing more in the next few months is investing in that longer term, more permanent, lasting solution, which inevitably is going to have an international component. So undermining that now seems to be moving in exactly the wrong dimension.
But that takes us right from the government response tracker into your area of expertise, Tom, about, in your book Gridlock, you talk about what makes it difficult for countries to cooperate. And yet on climate change, they did. So just as a final reflection, what grounds for optimism is there that we're going to see international cooperation, and where is that likely to happen?
So I'm an optimist, and I think that there is a pathway through this crisis that leaves us in a stronger place than when we started. As I mentioned in my book Gridlock, multilateralism is undermined. It has suffered decades, actually, of neglect and retrenchment. And that's because of long-term structural changes in the international politics, and also the more complex challenges like this pandemic that have challenged existing institutions. But this is not some sort of static problem. We see a lot of gridlock in global governance, but also a lot of innovation, a lot of moments of innovation and leadership. And actually, the 2014 crisis, Ebola crisis, was a good example of where two large countries at odds with each other, the United States and China, actually used that crisis as an unprecedented level of cooperation, where you had Chinese doctors flying on American military planes to West Africa to deliver medical aid. So this is a choice that I think political leaders can make. They've made it before. I don't see any reason why they can't make it again. And so that possibility of agency gives me some hope that we can actually end up here in a much better place.
So Tom, with this Oxford government response tracker and the way you've mobilized this 100 or so Oxford alumni, all very much as volunteers, how long might this go on, and how long do we need a tracker? What's the future of the Oxford government response tracker?
The sad reality, I'm afraid, is that we're going to be dealing with this pandemic for a good time to come. We're currently today at something like 11.8 million cases globally, 544,000 deaths. It's not going up, it's not going down. And that's going to require a sustained effort over months to get governments up to speed on. We're planning to keep the tracker going for that time, at least as for the next year, possibly further. We're also trying to adapt it. We've been adding indicators as governments have new responses. We try to adapt the tracker to be able to see what they're doing, because this pandemic is going to evolve and government responses are going to have to evolve. So we're going to have to evolve along with them. We're building this airplane as we fly it, which is a great adventure, but really made possible by those hundreds of volunteer data collectors. So if you're out there and you're an Oxford alumnus or student and you're thinking of becoming a data collector, do send us a message, because we'd love to have you as part of this effort.
And of course, the track is speaking right to the heart of the Blavatnik School mission, which is to improve government. And it's giving such fabulous material to our students as well as to leaders that come and study with us in the school about how to manage a crisis and how to learn from other governments in a way that helps you improve your policy rather than just using herd behaviour to copy them, and how to use science in policy effectively and rapidly and well. It's going to give us many case studies for many years to come. Thank you to Associate Professor Tom Hale, not just for the conversation today, but for the fantastic work that he has so quickly and rapidly led, which is helping world governments, researchers and newspapers and journalists and commentators and analysts around the world bring data to the crisis that we're living through. Oxford has hundreds of researchers working on different projects that are relevant to COVID, but also that are helping the world in a number of different ways. We hope you'll continue to join these conversations to hear about the research. For those of you that want to support it, I know the university is always looking for support so that we can fund these projects. Next week, Wednesday at the same time, the COVID conversation will be on the impact of COVID on schools and education, with two academics from the Department of Education. But for today, thank you for joining Tom Hale sharing with us the Oxford Government Response Tracker on COVID-19. I'm Nairi Woods. I'm Dean of the Blavatnik School, and I'd like to welcome you to the school once we're all allowed out of our lockdown. And I hope you'll enjoy further of these conversations. Thank you.
Thank you very much.
And goodbye.